Dear friends, let me introduce my friend and a colleague who is a specialist in internal medicine, but since so many years he has been practicing only homeopathic medicine. Dr. Malchow Holger. Good morning.
Good morning.
Good morning. So, the aim of this interview is to inform our colleagues in India regarding the current scenario of homeopathy in Switzerland and in Europe. So, could you briefly describe your curriculum in modern medicine, especially the years of studies and the specialization, etc., before you became a homeopathic doctor?
Okay, I decided to study medicine to become a homeopathic doctor, but this is not possible in Europe, and so I decided to study human medicine first, and I did this for 6 years in Germany, and after that I started a specialization in internal medicine for about 6 years, and during my work in an allopathic hospital, I worked in cardiology and in gastroenterology, and I had also experience in working on intensive care units, and I was also working as an emergency doctor. And at the end, after 6.5 years working in allopathic medicine, I changed and I started to work in a homeopathic practice first in Germany, and in 2005 I came here in Switzerland and started working in the clinic of Dr. Spinelli.
So how many years your studies from the beginning up to become a MD in internal medicine? How many years?
Including my studies, it was about 14 years.
14 years to studies.
Yes, 14 years of studies and all.
So, if you had continued your work in the modern medicine or the allopathic medicine, now you became a chief physician or something like that in your career. Why you have changed to homeopathic medicine?
I decided to be a homeopathic doctor at first, or to study medicine at all, because my father became sick when I was about 16, 17 years old, and my uncle is a professor of internal medicine, and he could not help my father. And so my father tried around different types of alternative medicine until he found a good homeopathic doctor, which finally could help him and bring him out of his disease. And this was the reason why I was interested to study medicine at all and to become a homeopathic doctor. And then when I was working in allopathic hospitals, I saw the advantages of the allopathic medicine. Example, in the acute medicine, if you have a patient with very severe conditions like a myocardial infarction, or you have to treat somebody on intensive care, so you have a big advantage of the modern medicine. But all for the other patients which have chronic diseases, chronic problems, there was no help, and there was no aim of curing. It was only of modeling, amelioration of symptoms, but not of a cure. And then when I left the hospital, I started working in a mixed practice. It was one part homeopathy, and the other part was normal allopathic medicine. Mm-hmm. And then I discovered that 70% of the patients wanted to have the both, the complementary medicine and also the normal.
Okay. So, thank you very much. How do you describe regarding current scenario of homeopathy in Europe, the legal status of homeopathy and the popularity of homeopathy in Switzerland and in Europe?
I would say homeopathy in Europe is very popular, also in Switzerland, for example, also in Germany or in France. If you look to the inquiries. 2/3 of the population for alternative medicine and especially for homeopathic treatment. The legal situation is quite different. In Switzerland, homeopathy is legal, it's accepted and it's paid by the normal insurance company, but this differs from country to country in Europe.
More or less, how many homeopathic doctors working in Switzerland?
Homeopathic doctors in Switzerland are about 250.
50.
Yes, and
in Germany, how much?
In Germany, there are about 6,000 to 7,000 homeopathic doctors in Germany. The numbers of the other European countries, I don't know. Okay. But we have more non-medical homeopaths in Switzerland and in Germany as well.
Could you briefly describe your activity in your hospital in Clinica Dr. Spinelli? What kind of pathologies are treated in your hospital with the classical homeopathy?
Yes, we treat in our clinic mostly patients with cancer. I would say about 90 to 95% of our patients are patients with cancer, and the most of them come with a very advanced cancer which had already done chemotherapy, operation and radiation, and the patients come for 40 days and then we are looking for the right homeopathic remedy, and then we follow them in an outpatient setting afterwards.
Could you tell me regarding the treatment, which type of medicines you are giving? Only the organotropic medicines or constitutional medicine? Which type of potencies? Can you explain a little bit?
Yes, well, our principle of homeopathy is following the rules, if you can say this, or if you want to emphasize to this, of Hahnemann and Kent and Künzli. Dr. Spinelli, our leader of the hospital, is a pupil of Dr. Künzli. So the most important part of our medication is this approach, and we are working with deep acting constitutional remedies since about 12 years, I would say. Now we have a more intensive collaboration with India, especially with Dr. Parikh, and therefore we are introduced more and more using also organotropic remedies for curing cancer. And in our experience, we can say that we need them both to help people. This always depends on the stage on which the patients are coming to us. The more advanced, the more we need also the organotropic remedies, and if the patients are coming in the beginning, we see very good success also with the constitutional remedies.
What do you say about the result of this treatment of the cancer patients?
The outcome? The outcome of the cancer patients. Yeah. Well, it depends on the stage in which they are coming. We can say that we can help our patients, but it depends very on the individual case if you can cure what you can achieve with the homeopathic treatment in the cancer patient. But in the most of the part, our patients do integrative medicine. That means that they are doing also conventional treatment like chemotherapy, and they are combining this with a homeopathic treatment.
Mm-hmm. In other ways, I can ask you, are you satisfied with your treatment?
Yes.
Homeopathic treatment?
Yes, we are very satisfied with our homeopathic treatment for the patients who are deciding that they will do both types of therapies, conventional and homeopathic treatment. We see that all the side effects of conventional treatment are responding very well to our homeopathic treatment, that most of our patients don't have big side effects and they can continue their normal lives. And we can see also that we can improve the prognosis of our patients which decide to do a complementary homeopathic treatment.
Thank you, Dr. Malchow. How is the interaction and collaboration with the allopathic doctors?
Well, in general, we have a good collaboration with our conventional colleagues. We need also them, and we ask all our patients to do regular controls by the oncologists, and we don't have problems, and we have a good friendship with our oncologists here in the town.
Thank you. Have you treated any patients with the Comet? How are the results?
Yes, we have some small experience. All of our colleagues together here in the clinics, I think we can say that we had about 50 patients with COVID or with a strong suspect of a COVID infection, and we can say that in the beginning of COVID disease, that means in the first 10-14 days after the onset of the first symptoms, we can help them very well, and we had also some patients with pneumonia which responded very well to homeopathic treatment.
What is your opinion including homeopathy as a preventive medicine against COVID? Are you agree?
Yes, we agree. We have two types of prevention of COVID infection. For the patients we have in constitutional homeopathic cure, we saw that giving the constitutional homeopathic remedy prevents the onset of COVID disease, and if they have only mild symptoms, the constitutional remedy is the best one against the cure.
Yeah. Medicines like arsenicum, bryone, etc. What about your opinion?
Giving
as
preventive, well, that depends. We did a little project with the personnel of our clinic, and there we had a two-line approach, if you want, telling this. If we saw some good constitutional symptoms, we opted for the constitutional remedies, and if we did not have constitutional symptoms, we gave prophylactic medication as arsen or bryonia.
Okay. What are the difference and difficulties in homeopathic prescription compared to the modern medicine prescription?
Well, it's a very different approach to the patient. I think that the most difference for me is that in homeopathy you are more close to the patient. You are more related. You have a more intense relationship to your patients because you're interested in the general or whole being of your patient, as physical as in the mental state, and in the conventional medicine you are more distant because you don't need so much details for the cure.
Okay. Are you satisfied with your profession as a homeopathic doctor, Dr. Malchow?
Yes, I'm very satisfied. I never regret that I quit allopathic medicine because my heart is beating for the homeopathy, and I can see that we have at all in our clinic wonderful results giving homeopathy also in very severe diseases.
Thank you. Do you have a message for the young doctors of homeopathy in India, or the students of homeopathy?
Yes, I would encourage them very much to go on studying homeopathy, because I think this is really the medicine of the future, because you can help a lot of people very well. And from my experience, it is also important to have knowledge of conventional medicine, because we cannot help all of our patients here in the clinic only with homeopathic medicine, but working, collaborating together with our colleagues from conventional medicine.
Thank you very much, Dr. Malchow.